Tommy is with his mother in a mental health clinic for evaluation. He is 7-year-old and is very difficult to deal with him. He used to fight with other kids, kick and throw pet animals of his house, broke the mirror of neighbor's vehicle. In addition, he lied to his mom that he is not the one who did these things. What could be the diagnosis? Tommy's case is clearly of a conduct disorder. Conduct disorder occurs in around 4% of the population. The condition becomes more prevalent in adolescents and tends to affect boys more often than girls. Continue to have problem into adulthood. Many develop antisocial personality disorder. Let's have a look at the types. There are three main types of conduct disorder: the childhood, the adolescence, and the unspecified. They are categorized according to the age at which symptoms of the disorder first occur. Childhood onset occur when the signs of conduct disorder appear before age 10. Adolescent onset occur when the signs of the conduct disorder appear during the teenage. And unspecified onset means the age at which conduct disorder first occur is unknown. Some children will be diagnosed with conduct disorder with limited prosocial emotions. Children with this specific conduct disorder are often described as callous or unemotional. Symptoms. Symptoms are divided into four main groups. They are aggression, deceitfulness, destruction, and violation of rules. Aggressive conduct may include intimidating or bullying others, aggression to people or animals on purpose, forcing someone into sexual activity, using a weapon. Deceitful behavior may include lying, breaking and entering, stealing, and forgery. Destructive behavior, it includes arson, that is setting fire, and other intentional destruction of property. Violation of rules, it may include skipping the school, running away from home, drug and alcohol use, sexual behavior at very young age. Let's have a look at the causes. It is believed that a combination of biological, environmental, psychological, and social factors play a role. Biological, it can be brain damage or genetical. Damage to the brain's frontal lobe has been linked to conduct disorder. The impairment of the frontal lobe may be genetic or inherited, or it may be caused by brain damage due to an injury. Many children and teens with conduct disorder have close family members with mental illness, including mood disorder, anxiety disorder, substance use disorder, and personality disorder. Psychosocial factors such as dysfunctional family life, childhood abuse, traumatic experiences, a family history of substance abuse, and inconsistent discipline by parents may contribute to the development of conduct disorder. Low socioeconomic status and not being accepted by the peers appear to be risk factor for the development of conduct disorder. Other psychiatric disorders. Often individuals diagnosed with conduct disorder typically also have co-occurring other psychiatric disorders. Individuals with depression, anxiety, as well as personality and bipolar disorder have an increased risk of developing conduct disorder. Diagnosis of the conduct disorder. Medical assessment. A physical exam and laboratory test, for example, Neuroimaging studies, blood tests, etc. may be done if there is concern that a physical illness might be causing the symptoms. Psychological assessment. A child psychiatrist or qualified mental health expert talk with parents and teachers about the child's behavior and may observe the child. For a conduct disorder diagnosis to be made, child must have a pattern of displaying at least 3 behaviors that are common to conduct disorder. Child must also have shown at least one of the behaviors within the past 6 months. The behavioral problems must also significantly impair the child's social behavior or the behavior at school. Management. It takes time to establish new attitudes and behavior patterns. Children with conduct disorder usually require long-term treatment. However, early treatment may slow the disorder's progression or reduce the severity of negative behaviors. Treatment will depend on child's symptoms, age, and general health. It will also depend on how severe the condition is. Treatment for conduct disorder may include psychotherapy. It is aimed at helping the child learn to express and control anger in more appropriate ways. For example, cognitive behavioral therapy. A child learns how to better solve problems, communicate, and handle stress. The child also learns how to control impulses and anger. Family therapy. This therapy makes changes in the family. It improves communication skills and family interactions. Peer group therapy. A child develops better social and interpersonal skills through the peer group therapy. Medication. These are not often used to treat conduct disorder, but a child may need them for other symptoms or disorders such as ADHD, anxiety, or depression. Tips for parents. Parent management training. It is aimed at helping parents learn how to better manage their child's behavior. Training is focused on enforcing rules, rewarding good behavior, learning how to negotiate and compromise with a child, and implementing effective discipline techniques. Set clear rules at home. Establishing rules that are reasonable, fair, logical, and consistent. The rules and the consequences for breaking them need to be enforced consistently. Positive reinforcement. Find ways to connect with child. Often praise whenever and wherever possible, and make it a point to highlight one or more things that your child does right each day. Self-care. Finding the time for yourself to eat well, exercise, and sleep well. When a parent is active in the treatment, the child is more likely to make positive behavioral changes. Hope you got a better understanding of the conduct disorder. So please subscribe for more videos on related topics. Thank you and keep smiling.